Hi guys, my name is Dr. Wasim Khan from Your Family Doctor, and today I'll be talking about everything you need to know about vitamin D and vitamin D deficiency. So let's get straight to it. So what is vitamin D? So vitamin D is what we call a fat soluble compound. This means that it's a chemical or an ingredient that can be dissolved inside fats. So when we eat any vitamin D containing foods or vitamin D tablets, these are taken up by what we call fat globules, which then travel through the small intestine and then through to the body through the bloodstream. So the major function of vitamin D is to help to regulate the absorption and metabolism of chemicals inside the body called calcium and phosphate. It also helps to maintain appropriate levels of calcium inside the blood. This in turn helps to maintain strong bones and teeth. There is also some evidence to suggest that appropriate levels of vitamin D inside the body helps to maintain a healthy immune system. However, further research needs to be done in this area. So the following adult vitamin D thresholds have been adopted by UK practitioners. So if the levels of vitamin D inside the body are less than 30 nanomoles per litre, then this means that you're deficient in vitamin D and something needs to be done about this. This is something that we'll discuss in a bit. If your levels are between 30 to 50 nanomoles per litre, then this may be adequate for some people, however, it may be inadequate for others. If your levels are above 50 nanomoles per litre, then this means that you've got adequate levels of vitamin D inside your body and you should continue with whatever you're doing at the moment, which is helping to maintain your vitamin D levels at an appropriate level, whether it's getting enough sunlight, whether it's eating the right foods, etc. Now going into the sources of vitamin D, the first is sunlight. So approximately 90% of the body's vitamin D will come from the action of ultraviolet B sunlight on the skin. In people with fair skin, exposure of the face, arms, the hands, the back to sunlight in the UK between April to September for approximately 15 minutes 2 to 3 times a week will result in adequate skin synthesis of vitamin D. The other source of vitamin D is through dietary intake. So this includes fish such as salmon, mackerel, sardines, full-fat milk, eggs, breakfast cereals, butter, cheese, margarine. So the recommended daily intake of vitamin D in the UK, for adults, it is recommended that they take 400 international units of vitamin D per day. For children aged between 6 months to 3 years of age, it's recommended that they take around 280 international units per day. And for children under the age of 6 months, it's recommended that they take 340 international units per day. So why does vitamin D deficiency happen? This goes back to what we discussed earlier in terms of the sources of vitamin D. So the first is sunlight. So if you're not getting enough sunlight through excessive covering of the skin with clothes, or if you're not getting out in the sun as much as you should do, or when you do go out into the sun, you're applying on a frequent basis excessive anti-ultraviolet B cream, then this can cause reduced levels of vitamin D. The other cause of reduced levels of vitamin D inside the body is if you're not getting enough dietary intake, whether it's that you're not eating enough fish, eggs, breakfast cereals, butter, margarine, and generally just not having a varied, nutritious diet. The other set of causes that may lead to a vitamin D deficiency include other medical problems that can cause a vitamin D deficiency, such as celiac disease, or if you've got problems with the liver or the kidney, these can also lead to a reduction in vitamin D levels. So in terms of the clinical features or symptoms that a patient may present with if they have vitamin D deficiency, these include, so the first important thing to note is that a patient may be asymptomatic. So this means that they may not have any symptoms at all, but may have vitamin D deficiency. And this may be an incidental finding where you've done a set of blood tests for another suspected condition, but they've been found to have a vitamin D deficiency. In the majority of patients, however, they'll present with muscular aches and pains and weakness. And if the weakness is particularly marked, especially around the glutes or the thigh area, then the patient may find it difficult to rise up from a chair. And in some patients, they may have what we call sort of a funny stance called a waddling gait.